Hi everyone, I'm Sean Kelly, Manager of Student Recruitment and Outreach at the Brown University School of Public Health. Welcome to our virtual fair. Today, we'll give you an idea of who we are and why students come to our School of Public Health. We'll provide some general information about Brown University and the School of Public Health, and then move to more specifics about each of our graduate degree programs. Please feel free to ask questions during the presentation, as our program administrators are managing the chat room. First, what is public health? Public health works to protect and improve population health through the art and science of preventing disease and promoting health. Some examples are access to clean drinking water, emergency preparedness, vaccination promotion and distribution, examining the effects of alcohol on teens and adults, promoting healthy eating and exercise behaviors, training researchers in South Africa to respond to the AIDS epidemic, and mapping environmental exposures and more. The school's academic activities are aligned along 7 fields of public health study. We welcome students from diverse academic backgrounds to apply. So why study at Brown? There are a few differences that make our educational experience unique. We don't just study theory, we put theory into action. And you'll hear it over and over again. We learn public health by doing public health. Brown's mission is to serve the community, the nation, and the world by discovering, communicating, and preserving knowledge. Our faculty aren't solely academics, they're public health practitioners. They bring experience from the field into the classroom, and their real-life stories make the lessons come alive. Brown is all about working together, often across disciplines and departments. You might have heard of Brown's open curriculum. It allows our students to take courses outside of the School of Public Health. If an economics or anthropology course fits your program of study, we encourage you to take it as an elective. And our small size is no accident. We're committed to an extremely low student-to-faculty ratio, ensuring personal attention from faculty members. Providence is small too. It's Rhode Island's capital city of about 180,000 people, and it's convenient to Boston and New York City. It's also a great place for graduate school, as Rhode Island has 11 colleges and universities, with approximately 70,000 college students moving in every year. Providence is very walkable. Our walk score is 92 at the School of Public Health, and it's a manageable city that provides students with hands-on access to industry, local government, and research and internship opportunities. And you'll find Brown alumni here too. For example, the director of Rhode Island's Department of Health is an alumna of our MPH program. Brown University was founded in 1764 and was the first U.S. university to welcome students from all religious backgrounds. It's the 3rd oldest university in New England and the 7th oldest in the United States. We're very proud of our more than 250-year history and tradition of freedom of thought and diversity. Brown is located on the east side of Providence in a neighborhood called College Hill. And downtown Providence is only a 5-minute walk down the hill from campus. Brown is one of the 7 Ivy League schools. With over 6,500 undergraduates, 2,200 graduate students, and 545 medical students, our students come from all 50 states and over 115 countries. 15% are international, 40% identify as students of color, and 17% are first-generation college students. The School of Public Health is an important part of the Brown community. So here are some facts and figures about our school. There are 227 graduate students in the school. Of these, 163 are master's students and 64 are PhD students. There are also 185 undergraduate public health concentrators in the school. We have 265 faculty members in the school who work across 4 academic departments and 13 research centers. Speaking of research, those 13 research centers generate over $55 million in research grants annually. And despite our size, we rank in the top 10 among all schools of public health for NIH funding. 10 of our research centers are located in our building on South Main Street, and 3 are based in nearby hospitals. Our goal is to prepare students to improve human health on a large scale, whether by influencing health policy, by designing better public health interventions, or by investigating environmental and community health risks. In our 13 research centers, students learn how to improve their skills by doing research that creates new knowledge about population health. Our students also have opportunities to work with the 7 Brown-affiliated hospitals, the Rhode Island Department of Health, and our network of local service providers and agencies. We also have strong ties with universities and organizations all over the world, including collaborations in China, Samoa, Brazil, Mexico, South Africa, Ghana, and the Philippines. We know that support is critical to your success. In addition to the mentorship students receive from faculty advisors, there are many other forms of support for students. You see a few examples listed here. The Writing Center provides free support for any member of the Brown community, including support for students whose first language is not English. The LGBTQ Center provides programming and support services and advocacy for the entire Brown community. The School of Public Health Graduate Student Council represents the student body on academic, social, and community service issues and events. And Brown's Career Lab provides help with advancing your career after graduation. They will help you with interview prep, career exploration, job search sessions, and more. Brown is a diverse and inclusive community engaged in teaching, research, and service opportunities. Brown demonstrated its commitment to diversity and inclusion in 2016 with an action plan titled Pathways to Diversity and Inclusion. The plan outlines a set of concrete actions to make Brown a more fully diverse and inclusive community. As part of Brown's action plan, the School of Public Health developed its own Diversity and Inclusion Action Plan, informed by the work of a committee of dedicated students, faculty, and staff. Our plan fosters an inclusive working and learning community that embraces all aspects of identity. We encourage you to reach out to Professor Caroline Kuo if you have any specific questions related to diversity and inclusion efforts at the school. Now on to admissions. The following admissions requirements apply to all graduate programs at the School of Public Health. We take a holistic approach to the selection process and set no minimum GPA or GRE scores. We consider your entire application. The following elements are required through the SOFIS application portal. You must supply official academic transcripts. A WES transcript evaluation is required for non-US institutions. Your personal statement should demonstrate competence in writing and explain your interest and commitment to public health. Let us know why public health, why Brown, and what brings you to the degree program you're interested in. Your resume should list relevant experiences in regards to education, work, volunteering, and research. GRE scores are required for all programs, but MCAT scores will be considered in lieu of GRE scores for MPH applicants. Subject tests are not required, but may be submitted. TOEFL or IELTS scores are required for international students unless you have a degree from an institution where the primary language is English. 3 letters of recommendation are required. At least 2 of those should be academic in nature. Interviews are not required, but we do encourage interested applicants to reach out to the department administrators or program directors with questions, and to faculty with whom you share research interests. You're always welcome to introduce yourself and your interest in their work. The School of Public Health offers 6 master's degree programs and 4 doctoral programs. All of our master's degree programs are designed to be completed in 2 years full-time. Part-time applicants are also welcome. All doctoral programs are designed to be completed in 4 years. While not required, most PhD students enter with a master's degree. Students are admitted for the fall semester only, and we do not have spring semester admissions. Now we'll go over some details for each of our graduate degree programs. The MPH is the largest of our degree programs, Approximately 50 students enroll each fall. This degree offers 8 concentrations and requires 13 courses, 5 required courses, 5 concentration courses, and 3 electives. Every MPH student completes an internship, which provides a practical experience to apply the theoretical concepts you've learned in class. There's also a thesis project requirement. The MPH encourages applicants of all academic backgrounds to apply. Where the MPH provides a broad public health education, the other master's degrees provide advanced training more specific to a particular field of public health. These degrees are for students who already know their focus area and have more narrowly focused interests. Behavioral and social health sciences provides training in analyzing the complex behavioral and social determinants of public health, and in developing interventions to change behaviors and improve social contexts related to public health. This degree is ideal for students interested in working in health program evaluation, program management, community-based organizations, and other nonprofit services, managed care, treatment intervention research, and clinical trials, or for those interested in pursuing doctoral level training in public health, psychology, or public policy. The special areas of focus in BSS include alcohol and addiction, substance use, exercise and physical activity, diet and nutrition, HIV/AIDS, health disparities associated with race and ethnicity, socioeconomic status, and other forms of social inequality. Applicants with backgrounds in public health, biology, psychology, sociology, anthropology, communications, and education are encouraged to apply. Biostatistics provides advanced training for individuals pursuing careers as professional statisticians or data analysts in industry, government, or academia. The master's degree is for those contemplating doctoral study in biostatistics and for established researchers seeking advanced training in biostatistics. Ideal candidates have academic backgrounds in math, biology, biochemistry, economics, or computer science, but others are encouraged to apply. Applicants to the master's program must have 3 semesters of calculus, 1 semester of linear algebra, and at least 1 semester of probability. Experience with numerical computing is also recommended. The master's degree has 2 different options, a Master of Arts, AM, option, and a Master of Science, SCM, option. All SCM candidates complete a thesis project, while AM students do not. The master's degree in clinical and translational research is designed primarily for physicians, doctorally trained basic scientists, and students in doctoral programs or medical school. The program provides training for clinicians and basic scientists to extend research into the clinical arena, leading to improvements in individual and population health. There are 7 required courses, 2 electives, and a series of required seminars, workshops, and mentoring sessions. The CTR is an applied program, so students work closely with advisors to develop a portfolio which includes a grant proposal, first author abstract, and a first author research manuscript. And a certificate program is also available. Epidemiology provides advanced training in the principles and practice of epidemiology, the study of diseases in given populations. Students learn to examine how and where disease outbreaks start and how diseases are transmitted among individuals in a population. If you're interested in conducting epidemiological research for federal, state, or local governments, in hospitals or academia, or in conducting fieldwork locally or globally, the Epidemiology Master's Program is right for you. This degree is also for those interested in doctoral level training in public health, preventative medicine, or public policy. Applicants with backgrounds in public health, biology, or chemistry are encouraged to apply. There are 12 courses total in the master's program, 8 required courses, 4 elective courses, and a thesis project required for the degree. Our newest degree program emphasizes public health in low and middle income countries. This degree provides rigorous training in global health theory and interventions, sociocultural awareness and competence, global health epidemiology and disparities, and international project implementation and evaluation. There are 12 required courses for this degree, including 9 required courses and 3 electives. There's an 8-week international fieldwork experience in which students usually complete in the summer between years 1 and 2. A thesis project is required. This degree differs from a biomedical or general public health degree because of its emphasis on social behavioral influences and global health disparities, implementation science, and community-based interventions in global settings. This program, available only as a PhD, offers training in research methods to advance knowledge of issues central to the improvement of population health, focusing on healthcare delivery systems, providers, and economic forces that shape behavior. Like all of our doctoral programs, applicants with a master's degree or advanced training are preferred. So we've shared a lot of information about the options available, but which degree is the right fit for you? In summary, the MPH is the broadest of public health programs and provides students with the option of participating in one of 8 concentrations and includes a required internship as part of the degree. The other master's programs are much more focused in a specific field of public health, and degree requirements vary by program. Please visit the program's website or speak with the program administrator for more information. We'll share their contact details in a later slide. You learned about the degree programs we offer in the School of Public Health. Now we'd like you to meet some of our students. Reuben graduated from Boston University with a major in health science and a minor in chemistry. His primary interest at Brown is epidemiology, with a specific focus on chronic diseases and cardiometabolic health. Reuben's long-term plans? Graduating from medical school in 2022 and combating health disparities in marginalized communities through accurate and up-to-date patient-centered care. Signe studied anthropology and political science at the University of Washington. She became interested in human behavior and the social science applications of public health, and came to Brown to pursue a master's in behavioral and social health sciences. Signe is currently working as a graduate research assistant in the Center for Alcohol and Addiction Studies at Brown. She's interested in reproductive health and has committed herself to a career establishing better reproductive health access for people everywhere. Megan attended UMass Amherst and completed an MPH at Yale before joining the Health Services Research Doctoral Program at Brown. Her award-winning dissertation investigated the impact of Medicaid expansion on community health centers, which provide primary care services to low-income, underserved patients, and vulnerable populations. Her findings suggest that expansion was associated with large gains in coverage, as well as increases in quality of care and patient volume, particularly in non-urban areas. She is now assistant professor at the BU School of Public Health in the Department of Health, Law, Public Policy, and Management. For the upcoming year, tuition is $6,790 per course. Master's students at Brown only pay for the courses they take, and PhD students receive tuition waivers and stipends. Master's fees for the year include a health services fee, health insurance fee, which may be waived, an activity fee, and a recreation fee. Total annual fees are $4,858, including insurance, and $1,012 if you qualify for a health insurance waiver. Because traditional financial aid does not continue to graduate study, we offer partial tuition scholarships. These scholarships are typically 25% of tuition on average. All applicants are automatically considered for this scholarship support, and there are no additional applications needed for the tuition scholarship. There are also options for conference travel support. Finally, some students may qualify for research or teaching assistantships, typically in their second year of study, which can help defray tuition costs. The application process is straightforward as we participate in the SOFAS application portal. We encourage you to create your profile before you're ready to apply, as SOFAS offers many resources to help inform your decision. Our department administrators are ready to answer any of your questions today and in the future. You can also direct your questions to sph-admissions@brown.edu. Some great ways to get a sense of our work and our community: check out our website for much more program-specific information. It will be completely refreshed later this summer, so we encourage you to bookmark the page. Any and all of our social media platforms, we encourage you to connect with us. They're easy to find by searching Brown Public Health, all one word. Thanks so much for joining us today, and please keep your questions coming. Our program administrators are happy to chat with you.